Assalamu alaikum, everybody. Hope you're doing well. Welcome to our session of Let's Talk. Today, our topic is what we are going to discuss is breast cancer awareness. October is the month of breast cancer awareness. The pink ribbon we see displayed on products in stores and supermarkets are a colorful reminder of the disease that affects 1 in 8 American women. It is also the second most common cancer in women in USA. Finding breast cancer early before it has spread is the key to successfully treating the disease, which is why we are here today to talk about the importance of breast cancer prevention and screening. We will try our best to answer most of the questions as well. With that being said, I would like to introduce one of the most amazing people who is our guest tonight, Dr. Uzma Iqbal. She is a hematologist and medical oncologist who has over 20 years of experience in treating cancer and blood disorders. Dr. Iqbal did her oncology fellowship in New York. She has been practicing oncology in Houston since 2007. She is an associate professor at University of Houston College of Medicine. She was an assistant professor at Einstein College of Medicine in New York and practiced there before moving to Houston. Welcome to our Let's Talk session, Dr. Uzma. Assalamu alaikum. How are you?
Walaikum salam, Sonia. How are you doing?
I'm doing great.
So, Sonia, this is, you started the topic very well by really explaining why now, why in October, and why we are doing what we are doing. October being the breast cancer awareness month, it's very important for us to bring this conversation, to our audiences, to our community. But before that, I actually want to just take this moment. I know you didn't introduce yourself, so I would like to go ahead and tell the audience a little bit about you. Okay. So Sonia Khan is actually a volunteer at An-Nisa Hope Center. And Sonia is actually doing an amazing work, which is that she works for the helpline. And she's also a financial caseworker for the women who are who the An-Nisa Hope Center treats, women who are victim to domestic violence and abuse, and who really are looking for help at a very vulnerable time in their life. So when we talk about awareness, there is so much that we must be aware of in our community, and more knowledge is more power. So Sonia, thank you so much. There's another, you're very brave, and then you've shared this with me that you're a breast cancer survivor, and that just brings this conversation to a very different level. It's very authentic, it's very vulnerable, it's a very personal conversation then. It isn't just about stats, it's about a person's journey. So why don't we do this? Instead of talking about stats and stuff, why don't we start with your journey? And you're young, and just tell me how you felt what was the circumstances when you were diagnosed? You must be very young at that time as well. So yes. Just briefly tell us how this whole thing came about.
So what is with me is when I'm really good about my doctor's appointments, I have to go physical, well women, everything. So it was just a regular well women visit with my gynecologist, and she was doing, she just felt like some kind of a lump when she was doing my, so she felt a lump, and she was like, okay, I feel something, but you're too young, and you don't have any family history. So I don't think anything, it's just going to be a cyst. But she said, just in case, because you know how it is at 40, the screening starts at 40. Before 40, there's no screening. So I was 38, and she said, let me just write a mammogram for you just in case, but I am 110% sure, it's just a cyst, And that's when it all started. I went for my mammogram. It showed there was a lump which was solid, then ultrasound, then biopsy, the results came, and it was cancer. And it was really, really hard on me, because what I was thinking is I was on the right track. I was doing all the right things. I was, healthy diet, exercise, everything was right. How can it happen to me? And there was no family history, but that's how it started.
You
And
bring up a very good point, Sonia, that a lot of people say, I'm not going to go for a mammogram because I don't have family history of breast cancer, right? And there is nobody on both sides of my family that has breast cancer. But it is a known fact that breast cancer in more than 90% of the time starts sporadic, which means that it can start in a person, in a woman who has no family history of breast cancer. And the hereditary breast cancers, where there are genes which are passed on from generations,
yeah,
is 5 to 10%. And these are specific, genes that definitely increase the chance of breast cancer, but it's a very small portion of the breast cancer. Majority of the breast cancer is going to start in people who may have never had a breast cancer history. And another point which you touch, which is extremely important, especially in our community and women, is because sometimes we don't put our health first. So when we say
yes,
like, because we feel well, that must mean we are well. So we don't go for the well woman exam. And even if we go, like we are shy, there's a lot of shyness about breast exams.
yes.
Even if it's a female physician, a lot of women don't feel very comfortable, exposing their breasts and getting a full exam there.
I
So
like to add something here, because when I was diagnosed, and because I've been very open about it, I have been vocal, I've been open. I am like this because I want to share my experience if I can help somebody who's going through this, or any family member, person himself. So when I was diagnosed and when I talked about it with my friends, I was really surprised to know my friends, most of my friends have not been to a gynecologist for 2 years, 3 years, 5 years. They haven't done well women exam. And they're my age. And I was surprised. I was like, why? And for me also, it's not like every year you have to go. If I would have skipped that year, if I would not have gone for my exam and would have gone the next year, the stage I was on, I would never have been. It would have been a very later stage where I had to go through a different treatment plan. So I think early detection is the key.
no,
So
you're absolutely right. So
anybody
basically,
who's listening needs to just be on it and be like, okay, we have to go yearly, because now, see, there was a time when people were saying 40 and above. Now I see so many people who are 35, 36, 37 who have breast cancer.
right. So
So
Sonia, that's a good point you raise. So basically, the screening guidelines in the United States, screening guidelines are based on studies by these organizations that use like thousands and thousands of women, and they see, does this help in survival, like how help people live longer. But for one particular person, it's the statistics matter and then don't matter. But the current guidelines say at age 40,
yeah,
every woman should get a screening mammogram. And
yes,
then from then on, it is yearly, and there's a little discrepancy. Some people say after 50, 60, you can do every other year, but there's a difference. So every year mammogram.
yeah,
And then some people say at age 75 or older, you need to stop, but that's not the recommendation. If somebody is in excellent health, they can continue mammograms even after the age 75. Okay. Now, what you're bringing up is a good point, that at age 30, this is a recommendation, every woman should be assessed for her risk for breast cancer. Now, how do you do that? You do that by going to one of your doctors, whether gynecologist. I mean, young women go to OB, gynae, or a primary care doctor, and there have your well woman exam. When you have your well woman exam, there are different parts to it, but one part of the well woman exam is a breast exam.
yes,
And so they will do your breast exam. Breast is an organ which is actually, the function of breast is to produce milk. So it has these like little pockets that produce milk and ducts that deliver milk to the nipple. Cancer can develop either in the lobule or in the duct, but the cancer will need to grow for quite some time before it can be palpated. So palpation means like what your doctor did, that it can be felt with the hand exam.
uh-huh.
Here, the importance of mammogram is that mammogram can pick up a breast cancer at a much smaller size than when you can palpate it. So for example, a palpation many times a size of a tumor can be about a quarter, the size of a quarter. Whereas if it is by mammogram, it can be the size of like a pea or even smaller. It can be small calcifications, which are small dots on the mammogram picture. So it's not only important to go to the doctors to let them assess your risk factors and discuss with you at age 30 onwards. And then from 40, start getting your screening mammograms. And if somebody's screening mammograms come abnormal, then they will order a diagnostic mammogram, which is a little bit more detailed, and an ultrasound. And that together increases the understanding of what the lump or the tumor or the mass is, and also checks the lymph nodes in the armpits. Yeah. So I want to talk to you about something. You brought up a point where when you shared that with, what was your experience when you got diagnosed and you decided to be brave and be open about it? What was the reaction you think you got? Like, do you think that people were open about it, or people are not? What was what did it take for you? How did you decide to be open and vocal about it? And what was your experience?
So when all this thing happened, I was trying to find or reach out to people who went through this, and I was not able to find, because it's a very personal thing. See, for me, I want to be open about it. I want to be vocal about it. I want to share my experience. Some people, they don't want to, and I understand that. So I was not able to find that kind of guidance or help in my community where I was trying to reach in. So that's when I decided that I want to try my best if I can help somebody with my experience, with my knowledge. And that was the point. But the people, how people react, they are very different. Family is different, friends are different. You know how this is, cancer is still a topic where it's not discussed, that it's still a taboo, like don't talk about it, don't tell about it. But I just said, no, I want to be the one who wants to just talk about it and help. If anybody, not even a single thing, see this, going to a doctor and getting examined is a small thing. If somebody even does that every year, it can help you so much. It's very important.
Right, and it's important because breast cancer is very important. 1 in 8 women is going to get breast cancer. So one of the risk factor is just of being a woman. Being a woman is a risk factor. Some other risk factors which are important is definitely a family history increases the chance. If the person who has cancer, they have family members who have the BRCA1, BRCA1, BRCA2 mutation, definitely increases the chance. But some of the other factors are hormone replacement therapy, which a lot of menopausal, postmenopausal women take. Birth control pills, these hormones which expose the body to estrogen. Estrogen is interesting because it's produced from our, the ovaries, but at the same time, it's also produced in the fat cells. So obesity or overweight is also a risk factor. So the important aspect of cancer risk factor, breast cancer risk factor, is that it can be something which we can't control. Like, we can't control the fact that we are biologically women. We can identify as whatever, but however anybody is comfortable. But biologically, if somebody is a woman, there's the higher risk. In addition, if there is a gene. In addition, if somebody is Ashkenazi Jewish background, there's a higher chance because of the intermarriages and the higher incidence of BRCA1, BRCA2 genes. But there are certain things that we can change. It is also known that women who have early puberty and late menopause, women who have not had a child, because again, estrogen being produced and the estrogen progesterone balance not being there. So, but then people who drink excessive alcohol, people who are overweight, people who do not exercise, people who do not go for screening testing, they are putting themselves at a higher risk. So we need to understand that the risks can be lifestyle as well. And once somebody does develop breast cancer, then the family history kind of changes in that. So tell me, so let's talk about a little bit about your journey through that. Like, was the decision making, was there a trust? Because a lot many times I also feel that what you were discussing earlier was that trust on your healthcare provider, a trust with your community. And then community can come together and rally behind, each other.
Yes.
And help. Like what I recommend is, if you're feeling afraid to go to mammogram alone, maybe 4 or 5 friends can go together and, make like a nice, like a friend day out of it.
Yeah.
Or co-workers can go together. So what was your experience once you got diagnosed and going through the process, personally, your family, how it disrupts everything once the diagnosis is already made?
Yeah. So I have to just go a little bit back and just let you know that when I was going through all these testing and everything, I was just doing it on. I just did not want it to share at that time with my family to, right now I'm going for my mammogram or I'm going for this. And I was going to these appointments by myself because I said, no, I can do it. So most of it, until I got the results and I found out that it is cancer, I even went to get to know the results by myself. My doctor even asked, do you have somebody with you? I said, no, I'm here by myself. And then she disclosed it. After that, I had a very strong support system, my family, my friends, my neighbors. As soon as everybody found out, mashallah, my mom was here, my sister was here, everybody just came here. In the beginning, right away, it was a little hard because my mom lives in Pakistan. It was hard for her to just book the flight and come right away. So my neighbors, I am so blessed. My neighbors were there for me, picking up my kids 6 o'clock, dropping off in the morning, picking up, because you know how it is. When you get diagnosed, you have so many more testing going on, MRIs. So I was like, wherever I get an appointment, I have to be there, even if it's spring, if it's in Sugar Land. So I have 7 o'clock appointment. So my neighbors helped me so much, dropping my kids off to the bus, picking them up. Lovely support from them. My family was always there, my friends. I think this counts a lot. You need a lot of support from your family.
And you need support for several reasons, Sonia. You need support for, like you're saying, I think a lot of people also, that there is a reason why people don't go for getting screenings, right? It could be financial, right? They don't have insurance, or they don't think that the insurance covers, although insurance is covered.
Yeah.
Even if somebody does not have insurance, they can go to like these programs like Rose.
Yes.
They do free or very economical mammograms. They can even do biopsies, and they can make referrals. People also don't go because they feel they're so intimidated that if it does turn out positive, what are we going to do? How will it affect the family? What will the society say? What will the community say? How will it affect my relationship with my husband if somebody is in a relationship? And not just there, I think it goes throughout the process. So when you do surgery, whenever there's a lumpectomy or a mastectomy, there's a little disfigurement, sometimes little, sometimes a lot. And there's a lot of, even if it's not stigma or taboo, there's a lot of personal sense of violation that is associated with it, getting to look at yourself in this way. And I think that's where people anticipate that. Yeah. And the fear of all that stops them even from taking that first step in going and getting like the mammogram. And the mammogram, if done early. So there are 4 stages of cancer: stage 1, 2, 3, 4. 1 is if it is only in the breast and small size. Stage 2, if it is larger in the breast or few lymph nodes are involved. Stage 3 is if it is much larger and a lot of lymph nodes in the armpit are involved or in the neck are involved. And stage 4 is if the cancer has spread out of the breast and has gone to either lung or liver or brain or bone. The survival rates actually dramatically change in these. The survival rate for stage 0, which is cancer so early that it's still within the duct, like I talked about the duct and the lobule. It's about 100% chance that with proper treatment, women can be cured. Stage 1 is about 98% chance. Stage 2 is 93% chance. At 5 years, somebody will be cancer-free. Stage 3, it drops to 72, and stage 4, 22% that they will be alive at. So the fact that somebody should get screened early and diagnosed early doesn't just mean you pick it. It has implications. It has implications because it's going to be treated for more curative intent. Like you could be cured of this cancer, and the chance for it to come back is, like I said, from 198, 93 for stage 0, 1, and 2 to 72 and 22 at 3 and 4. So this fear is valid, but there is equally valid reasons why somebody should go and get this tested early.
I would just say that for me, or people should ask these questions themselves when they have these thoughts. Do you want to see your kids, all the happiness or all the stages of their life? Or, I mean, that's the very important question for me. I want to be there for my family. I want to be there for them. For that reason, I have to do all these things. I want to do all these things so I can be there for them. If I will avoid it, there are going to be really, it's very risky. So everybody who is thinking about it, oh, should I go because of this reason? What if I get diagnosed? I want to be there for my kids. I want to be there for my parents.
Right. So, and this, like for us, it's also, it's like there's these benefits of this world, but for almost all faith traditions, God has prescribed, for a body, because it's a gift, yes, to take care of it and invest in it. Like like in our faith tradition, there are hadith after hadith where there's this hadith narrated by Abbas, where Prophet Muhammad said there are two blessings that many people are deceived into losing: health and free time. So there is a lot of enough for us. It's a scriptural. It's actually ordained, prescribed upon us, mm-hmm, to take care of our body and to actually, because we are part of a ummah, we are part of a community. And while we are individual, our own personal health affects so many other aspects. So I just want to touch upon very quickly, we may have about 6-7 minutes left, because we did start a little late, about the treatments, because a lot of people like, what's going to happen? So the treatment of the cancer, breast cancer, is done more like either if it is local, which is around breast, or systemic, which is if cancer cells travel to get to other parts of the body through blood. So we treat either with the hormonal tablets or chemotherapy. Early cancers are treated by surgery and radiation. And more advanced cancers are treated also by chemo and first chemo to shrink it, and then surgery, and then radiation, and then hormones. Because there are differences in cancers, like not all breast cancers are equal, and then the treatments can be different. I also want to touch upon that breast cancer isn't only a disease of women. Men also have breast cancer, much less than women. So if somebody knows of a man who has a lump in the breast, it needs to be checked also. Like they need to go to their primary care doctor. Actually, they also get evaluated via ultrasounds. And so we need to be aware of these things. And that's why awareness is important. We can't, once we are aware of something, we may take the right proper steps to prevent it from happening. And sometimes if we can't prevent, we can at least detect it early, yeah, so that we can do a better, more definitive treatment for it. So I think we really need to, with this conversation, October being the Breast Cancer Awareness Month, encourage women and men to encourage their women and actually take day off and take their women. I think women also need to understand that they are the CEOs of a family. They lead the whole family. So if you are down, your establishment is down, right? I mean, then your children, your husband, everything kind of sort of falls apart. So let's lead from the front. Let's lead in service. And I think self-compassion isn't selfish. So if we are compassionate with ourselves, that's fantastic. That's nothing wrong with that. So
I have a question.
Yes.
So how would you explain self-examination? I mean, at what age should we start self-examination? Is there a certain age where we should start doing because a lot of times you can also detect by feeling it by yourself.
Right. So that's a very good question. So what happens is younger women, like pre-puberty or puberty young girls, they may have a lumpy breast because of the hormonal changes that are happening. So not all lumps are cancer, right? So examination starts after, that's around like the same ages where we start to test this, where we start to kind of like go for our well-women exams and stuff. So the self-exam is done for the full breast. It's usually done about a week after a woman finishes her period. It can be done in a shower, it can be done standing, or you can be laying flat. With a full palm, you go to different parts in the breast, and you also feel under your armpits and on top of your collarbone. So what you're feeling is any lumpiness. Now, not all lumpiness needs an immediate mammogram, but if you feel something which is hard, which is because a lot of people think, well, it's not hurting, so it's not cancer. Well, a lot of cancer is not painful. So some of these may be what we call fibroadenomas, small glands, which come and go. But that's why you need to go to a doctor. So when you go and you let the doctor examine, they may be able to tell you, reassure you, let's just check it again after your next period. And so all of that is, but self-breast exam is actually a monthly exam that every woman should do at home, and there are many charts available.
So with that, the next question I have is, what are some of the symptoms of breast cancer that someone should be concerned about to discuss with their primary care or specialist?
So the breast cancer itself, symptoms come late. Like you start feeling a lump, but you could have asymmetry of the breast. One is like a little puckered, or it's like they call it like the skin becomes more skin like of an orange, or the nipple can be inverted, or you could have a discharge from the nipple, or the lump feeling. So all of this can be secondary to an underlying breast cancer. And there are others, but these are some of the more common ones: a lump, or skin changes, or inverted nipple, or asymmetry in the breast.
All right, so there's like some misconceptions which I was reading about. So one of it I read, it said every breast cancer is the same. Is it true?
No, it's not. Why? Because a lot of women also do that. Like when they get diagnosed, they're like, okay, why am I being offered chemotherapy? My neighbor got breast cancer and they were only on pills. Their breast cancer is different types. There are hormone positive, hormone negative, HER2 positive, HER2 negative, triple negative. So these are each cancer cell can have certain characteristics that define whether it's aggressive, if the lymph nodes are involved, if the lymph nodes are not involved. So you're right. If somebody knows of a person of a breast cancer diagnosis that is being treated a certain way, that doesn't mean everybody's going to get treated the same way. So no, not all breast cancers are the same. And that's why we need to go through the whole diagnostic process.
So another question which I have from other people, they are concerned about it. Some women are scared of mammograms because they think mammogram can cause breast cancer to spread.
So this is not accurate. There is radiation that is associated with mammogram, but when you look at the amount of radiation that a woman is being exposed to and the benefit that somebody may get, it's the cost benefit ratio outweighs for the screening, and it favors more screening. Now, I'm not going to say screening is without its faults. Like if somebody gets screened for a lump and they get a biopsy, it comes negative, there's a lot of anticipation. But by and large, if you go to a doctor and they order a mammogram and a mammogram gets done, there are certain protocols that get followed. So yes, a mammogram should not and does not spread cancer. Neither does biopsy. Many people say biopsy will, once you poke the tumor will spread. This has been shown not true.
So birth control pills cause breast cancer?
Birth control pills, hormone replacement therapies do increase the chance of breast cancer. Yes, they do.
Okay. So that's all I have for today. I think you did tell us very good points, and I think a lot of women are going to be able to get help with this session. do you have anything else to say,
Well,
Doctor?
Sonia, first of all, I want to thank you because what you did today is not only brave, but it is because this is actually what awareness is. It isn't just a doctor sitting somewhere and reading or telling these like dry statistics. It is really you put a face and a story and a journey to you give heart to this conversation. So first of all, thank you on behalf of the entire community. I want to thank you for being so brave and coming forward and being part of this conversation. Inshallah, you'll be cured and you're going to see a lot of your happiness of your family. But this will always be with you. The bravery will always be with you, and it's going to encourage a lot of women. I think it's going to encourage way more than anything I could have said alone would encourage. I also want to talk to women because a lot of actually in Asia, Pakistani women have the highest risk of breast cancer. It is so no matter where we look at, the risk is there. The best thing we can do is understand the risk, look at the risk in the eye, and do what we can. Like we stop at the red light, we put our seatbelt on, you know. So I think that's what it is. And I also want to thank An-Nisa for providing this platform for where we can come and have these engaging conversations. There are so many different topics that need to be discussed. But I really am very, very appreciative of what you do for An-Nisa and what An-Nisa does for the community. But I think it takes all of us put together to make a difference. So I want to thank you and An-Nisa as well. This conversation can go on.
And I think this is one of the first sessions. We will be having more sessions, more information about breast cancer, because there's so much we still need to know. But thank you so much for joining us, Dr. Uzma. It was a pleasure having you, and you're such an amazing person, seriously.
Thank you so much. Your pleasure was all mine, and it's a service we do for our community. So thank you very much. And may God bless you and give you complete shifa.
Thanks everybody for joining in, and I hope this session did answer some of your questions, and see you next time, inshallah. Thank you. Allah Hafiz.
Inshallah. Allah Hafiz.